Mental health, substance use, and homelessness. Statistics have shown that individuals who have poor mental health are more likely to make decisions or life choices that could lead them to homelessness. Depending on what things lead them to make the choices they do, what mental health disorder or disorders they may have, they could make permanent decisions that could impact them and their families in a negative way. Choosing to buy drugs or other substances to offset a mental health disorder instead of choosing medication or going to the doctors for help can be known as self-medicating, but it can also be destructive, like if a person chooses buying substances over giving house or apartment rent. There could also be an issue with insurance, and if that person does not have insurance, they may feel like their only relief is the substance or substances they may choose. This is why the government and the state are working together to try and get everyone on insurance so that they will have coverage when it comes to health care, along with mental health care. Medical insurances are hopefully working toward making any care for mental health a part of their plans because it is a fact that medical and mental health coincide with one another. We are moving toward a more patient-based approach in which doctors, therapists, social workers, etc. are all working together so that the consumer has the best care possible as an outcome. A group of individuals were interviewed, which included 350 homeless adults, all of which aged 50 and older, and they all shared their current health status. Many of these people had recent or co-occurring disorders, which combines mental health and substance use together as one, trying to offset the other. Individuals who first became homeless before the age of 50 had higher rates of mental health and substance use disorders that showed problems with ADLS, which is activities of daily living. Instead of shunning those that are homeless, shouldn't we advocate for them in the mental health field? Maybe if we stop stereotyping and having stigma in our culture, individuals would have the courage to reach out for help when they really need it. With a combination of the layoff crisis happening within the US, pay reductions, bankruptcies, chronic mental health disorders, serious mental illnesses, substance use disorders, along with health care, it can make it hard for individuals to pay the rent and get by each day. Not only do many of these individuals have to choose between their family needs and their own, they are having to choose between paying the rent, paying for groceries if they aren't receiving funding, or paying for medication if their insurance doesn't cover it, where it is mental health or substance use related. They may also opt to choose to pay for drugs or alcohol if they feel they get some relief and it is cheaper than medication. They may also be nervous to reach out for help. Almost 1 in 10 homeless youth in Maine have used heroin during their lifetime, a rate that was almost twice as much as Maine high school students. Alcohol is also the most used substance in youth in Maine, so the projection for these individuals to have poor grades, mental health and substance use disorders, along with making poor decisions that could lead them to being homeless is a really high rate. In 2012, 18 to 25-year-olds, 1 in 10 of these individuals reported having consumed at least one drink in the last 30 days. In addition, more than 1 in 10 high school students have reported smoking cigarettes or a cigar in the past 30 days. This is the age when people are finding out who they are, getting ready to go to college or go straight into the workforce with no further education. This is a vulnerable age in which big decisions are in the process of being made. As of 2013, the overall U.S. population has seen a decline in homelessness by 7.6%. But in Maine, it went up 26%. This involves families, veterans, children, adolescents, etc. We need to work together as a state and as a culture to help those around us, those that are struggling within the community. We wouldn't realize what small things could really help those in need, and we need to pass the kindness along, as well as not take part in the stigma around us against mental health and the mental health field. We need to be advocates for individuals because who do they really have that is fighting for them? They may have no one and feel like giving up. It's amazing what small things people can do that will make a difference in one's life. I did my volunteer hours at the Mid-Maine Homeless Shelter this semester. It was a fulfilling experience that impacted me in a way that I didn't know it would. I have seen how people have had hard times, how rough it can be on these people to be homeless, and to need the help. How embarrassed they were to be there, although everyone needs a little boost to get back on their feet. I really appreciate the staff at the shelter and everyone who pitched in to make it a little easier on those that were in need. Everyone was just so dedicating to helping others. While I was there, I helped organize storage rooms and place items where they needed to go for the shelter store, which is something they're getting ready to open up. I also helped label jewelry within the store and place clothing in their appropriate locations. I also helped with childcare as well as cleaning around the facility. I will definitely consider volunteering at the Mid Maine Homeless Shelter in the future. To see the selflessness people and organizations that donated their time and services to help the community was really inspiring and made my heart full.